For local high schools, springtime means baseball season. But just like any other sport, baseball season also means wear and tear on the body, especially on the arm. Many people probably believe that throwing this 9 to 10 inch ball is easy, but the repetitive violent motion of throwing a baseball can cause a lot of strain on the arm. Because of the repetitiveness when pitching and the lack of arm structure development in high schoolers, injuries can occur more easily in both the shoulder and elbow.
Most of the time you see overuse type of things, tendinitis, rotator cuff tendinitis, sometimes you have a biceps tendinitis, sometimes you get the tendinitis in the elbow, depending on technique and mechanics.
But the elbow can also be a cause for concern for pitchers.
In the elbow, big common one, obviously there's tendinitis issues. There are tendons that hold the elbow in place and they can become inflamed and painful. The next thing that most people talk about is Tommy John. And that's whenever you actually tear one of the ligaments, your ulnar collateral ligament of the elbow.
Contrary to popular belief, curveballs and pitch counts are not the biggest cause for concern, but it is the lack of proper pitching mechanics.
The biggest problem I see if you're going to be pitching a lot or pitching at all is if you don't have proper technique and proper mechanics, you're screwed. You just are. You're going to have injuries.
I know that people still talk about curveballs. Well, if curveballs thrown properly, it doesn't matter what age you throw it. Pitch counts, sure, that's probably towards the bottom of reasons why people get injured. More than anything, it's mechanics and breaks, scapular area.
After suffering any sort of arm injury in the shoulder or elbow, the full recovery back to pitching can take months, and the process can be quite tedious.
When we talk about throwers and then the return to play process, they're not allowed to just go out there and haul a pitch. They're going to start with soft toss. They're just going to be tossing back and forth. They're not even going to get into their pitching form for a while.
You have to be honest about your arm, and you have to be careful with it. I mean, we all have to play through some pain, and we all have to play through some discomfort, but when you're dealing with your arm, the shoulder, down in the elbow area, you don't want to mess around.
For the Center County Report, I'm Ross and Santa.